Hey everyone, welcome back. Today we're going to be tackling a case report that really, brings to light the dangers of bromethalin-based rodenticides.
Yeah, it's a really thought-provoking case.
You know those like little black pellets people put out to get rid of mice and rats?
Hmm.
They can be super deadly to pets, and this case really shows just how dangerous that toxicity can be.
It does. This case report focuses on delayed brain herniation in a cat following bromethalin intoxication, and it's a reminder that we can see long-term complications even when the initial treatment appears to be successful.
So before we get into the specifics of this case, can we take a step back for those of us who aren't, veterinary neurologists?
Yeah.
Can you explain what bromethalin is and how it works in the body?
Absolutely. So bromethalin is a neurotoxic rodenticide, and it's becoming an increasingly popular choice for pest control.
Okay.
But the way it works is pretty complex. It disrupts something called oxidative phosphorylation, which is the process our cells use to produce energy. Essentially, it starves the cells of the fuel they need to function, and that can have really devastating effects throughout the body, but especially in the nervous system.
Okay, so it's not just a simple poison that kills cells outright. It
Yeah.
throws a wrench in their whole energy production system.
Precisely. And without that, energy cells can't maintain their normal functions.
Right.
One of the really critical things that get disrupted is the balance of fluids and electrolytes within the cells. And so this leads to fluid buildup or edema, particularly in the brain and spinal cord.
So,
And that pressure from the swelling is what causes the neurological damage we see in bromethalin poisoning.
that makes sense. So in this case, we're dealing with a 2-year-old cat
Yeah.
that was brought to a veterinary referral hospital.
Yes.
What was going on with this poor kitty?
So the cat initially presented with a history of mild paraparesis, so that means weakness in the hind limb. The referring veterinarian had observed signs like a crouched gait, difficulty walking, but things took a turn for the worse, and the cat's condition deteriorated rapidly, and this is what led to a referral for specialized care.
Oh, so it sounds like whatever was going on, it was progressing quickly?
Yeah.
What did the specialist at the referral hospital find?
Well, upon arrival at the hospital, the cat exhibited tetraparesis, meaning weakness in all 4 limbs. They had obtundation, which means a decreased level of consciousness. They noted mydriasis, which is dilated pupils, and anisocoria, meaning the pupils were unequal in size.
Wow.
These are all signs of neurological dysfunction, and given the history of potential rodenticide exposure, bromethalin toxicity was high on the list of possible diagnoses.
It's scary how quickly things can escalate with these types of poisonings.
It really is, and unfortunately, there's no specific test to definitively diagnose bromethalin poisoning.
Right.
The diagnosis is often based on a combination of clinical signs, history of exposure, and ruling out other possible causes.
So in this case, how did they confirm that the cat had indeed ingested bromethalin?
That's a great question.
Yeah.
So while they couldn't confirm it at that moment, they initiated treatment based on a strong suspicion of bromethalin poisoning.
Okay.
The cat's clinical presentation, combined with the owner's report of finding a chewed rodenticide package, made it the most likely culprit.
So it's like a little bit of a detective game.
Yeah.
Putting the pieces together to arrive at the most probable diagnosis.
Exactly. And because time is of the essence with bromethalin poisoning, they didn't wait for definitive confirmation before starting treatment.
So let's talk about treatment. What did they do for this cat?
They implemented an aggressive multimodal treatment plan, which included a combination of decontamination measures, medications to address specific symptoms, and supportive care to stabilize the cat's overall condition.
Okay, can you break that down for us a little bit? What were the specific treatments?
Sure. On the decontamination front, they administered activated charcoal repeatedly. To try and bind any remaining toxin in the cat's stomach and intestines, they also used a medication called cholestermina, which binds to bile acids in the gut to try and reduce the reabsorption of the toxin.
Okay. And what about the medications to address the neurological symptoms?
So they used a combination of therapies, including osmotherapy with hypertonic saline and mannitol to reduce brain swelling, corticosteroids like methylprednisolone and dexamethasone to reduce inflammation, and intralipid emulsion therapy, or ILE,
Right.
to potentially bind and remove the toxin from the bloodstream.
ILE therapy is something I've heard about more and more in recent years for treating various types of poisonings? How does that work?
So ILE works by essentially creating a lipid sink in the bloodstream. It's a solution of fat that's given intravenously, and it attracts fat-soluble toxins like bromethalin.
Yep.
It binds to them and helps to pull them out of the tissues and into the bloodstream where they can be eliminated from the body.
So it's like a sponge for toxins, soaking them up and carrying them away.
That's a good way to think about it.
I like that.
In addition to those mainstays, they also use ginkgo biloba and thiamine for their antioxidant properties, levetiracetam to manage potential seizures, and various medications to control nausea and vomiting.
Wow, it sounds like they threw everything they could at this case.
They really did, and initially it seemed like the cat was responding well to treatment.
Really? Tell us about that.
So within a couple of days, the cat's mentation or level of consciousness started to improve. It became more alert and responsive, and over the next few days, it even regained some motor function, becoming more mobile and coordinated.
That's encouraging. So what happened next?
Well, after 6 days of hospitalization, the cat had improved enough to be discharged.
Wow.
You can imagine the relief the owners must have felt seeing their furry friend seemingly on the road to recovery.
I know it's always such a good feeling when a patient turns a corner like that,
Yeah.
but I have a feeling this story doesn't have a completely happy ending, does it?
Unfortunately not. 9 days after being discharged, the cat was found dead at home.
Oh no, that's heartbreaking. What happened? Was it like a sudden decline, or were there any warning signs?
That's what makes this case so unique and concerning. The death was completely unexpected. The owners reported that the cat had been doing well at home, eating, drinking, and interacting normally, and then tragically they found the cat deceased one morning.
So they went from seeing their cat seemingly on the mend to like this sudden and devastating loss. I can't imagine what they must have gone through.
It's a stark reminder that bromethalin poisoning can have long-lasting and unpredictable effects even when initial treatment appears successful.
So what did they learn from the necropsy? Like, what caused the cat's sudden death?
The post-mortem examination revealed a devastating finding: transforaminal brain herniation.
Oh, wow.
Essentially, the persistent pressure from the brain swelling had forced a portion of the cerebellum, which is the part of the brain responsible for coordination and balance, to herniate through an opening at the base of the skull.
So even though the cat seemed to be recovering, the damage to the brain was continuing to progress silently, ultimately leading to this fatal herniation.
Precisely. And this case highlights the insidious nature of bromethalin toxicity. Even with aggressive treatment, there can be delayed and devastating consequences.
This case report includes a figure 1 that visually depicts the extent of the damage in the cat's brain.
Yeah.
It's quite striking.
It really is. Figure 1 shows a series of images of the cat's brain, both in situ, meaning in its natural position within the skull, and after being removed and sectioned.
Okay.
And these images, along with microscopic examination, paint a clear picture of the severe brain compression and widespread white matter changes caused by the bromethalin.
Before we dive into the details of Figure 1,
Yeah.
can we take a step back and talk about the overall effectiveness of the treatments used in this case? I mean, there was a whole cocktail of therapies, but ultimately the cat didn't survive.
Right.
It makes you wonder which treatments, if any, were truly beneficial.
That's a great question, and it's something that researchers are still trying to figure out. There's no one-size-fits-all approach to treating bromethalin poisoning, and the effectiveness of various therapies, particularly in cats, is still largely unknown.
So let's break down the different treatment approaches used in this case, starting with osmotherapy.
Sure.
What is that?
Osmotherapy, which involves using agents like hypertonic saline and mannitol to draw fluid out of the brain, is a common practice in cases of brain swelling.
Okay.
But whether it's truly effective in bromethalin poisoning is debatable.
Why is that?
So some experts believe that osmotic agents might not be very effective in these cases because the fluid buildup isn't just in the spaces between the brain cells, but also within the cells themselves and within the myelin sheath, which is the fatty covering that insulates nerve fibers.
Right.
It's like trying to drain a swamp by digging a ditch around it. You're not addressing the water that's already soaked into the ground.
That's a good analogy.
Right.
So even though the cat, in this case, received osmotherapy, it's possible it didn't significantly impact the outcome.
That's certainly possible, and it highlights the need for more research to determine the best use of osmotherapy in bromethalin cases.
Okay, what about the use of corticosteroids? They're often used to reduce inflammation.
Yeah.
But are they helpful in bromethalin poisoning?
Again, the evidence is mixed. Some studies suggest that corticosteroids like methylprednisolone and dexamethasone might offer some benefit potentially by reducing inflammation and stabilizing cell membranes, but other studies haven't shown a clear benefit.
It seems like we need more research to figure out if and how corticosteroids should be used in these cases.
Absolutely. And then there's the intriguing use of intralipid emulsion therapy, or ILE,
Right.
which we talked about earlier.
Right, the lipid sink. It seems like ILE is becoming more popular for treating various toxicities, but is it effective for bromethalin poisoning?
So there have been reports of IL being used successfully in dogs with bromethalin poisoning. And there's a growing body of anecdotal evidence suggesting it might be beneficial in cats as well, but we need more rigorous scientific studies to confirm its efficacy and determine the optimal dosage and timing for administration.
In this case, the cat received ILE after its condition had already begun to decline.
Right.
Do we know if it played a role in the initial improvement?
It's difficult to say for sure. Bromethalin is absorbed very quickly, so the effectiveness of IL might be limited if it's not given very early on after ingestion.
So early intervention is key.
Absolutely. The sooner we can start decontamination efforts, the better the chances of preventing severe neurological damage.
And that brings us to the other decontamination measures used, in this case, activated charcoal and cholestyramine.
Right.
Let's talk about those.
So activated charcoal is a mainstay of decontamination for many types of poisoning.
Okay.
It works by binding to the toxin in the gut, preventing its absorption into the bloodstream.
But there's a catch with bromethalin.
Yeah, you got it. Bromethalin has a long half-life, meaning it stays in the body for a long time, and it undergoes something called enterohepatic recirculation, which means that it can be reabsorbed from the gut even after being bound by activated charcoal.
Oh, so it's like a revolving door for the toxin. It gets bound in the gut, but then it can be released back into the bloodstream and continue to circulate.
Exactly. That's why repeated doses of activated charcoal are often necessary, which is what was done in this case. The cat was given activated charcoal every 8 hours for 2 days.
Wow. Okay. And cholestyramine was also used to try to interrupt this enterohepatic recirculation?
Right.
How does that work?
So cholestyramine is a type of resin that binds to bile acids in the gut.
Okay.
Since bromethalin is excreted in bile by binding to those bile acids, cholestyramine can help prevent the toxin from being reabsorbed back into the bloodstream.
But again, like with many of the other treatments, its effectiveness in bromethalin poisoning isn't well established.
Yeah, unfortunately, we lack conclusive evidence to support its use in these cases. However, given the potential benefits and the relatively low risk of side effects, it's often considered as part of a comprehensive treatment plan.
It's like we're trying to cover all our bases even if we don't have all the answers yet.
That's a good way to put it. We're constantly learning and refining our approach to managing these challenging cases.
The other interesting therapies used in this case were ginkgo biloba and thiamine, both known for their antioxidant properties. What's the thinking behind using them for bromethalin poisoning?
So bromethalin is known to cause oxidative stress, which is basically an imbalance between free radicals, which are harmful molecules that can damage cells, and antioxidants, which are substances that can neutralize those free radicals.
Okay.
So the idea is that antioxidants like ginkgo biloba and thiamine might help protect cells from damage caused by bromethalin.
So it's like giving the body extra ammunition to fight off the toxic effects of bromethalin.
Exactly. And there's some evidence to suggest that ginkgo biloba in particular might offer neuroprotective effects.
Okay.
But again, more research is needed to confirm these findings and to determine the optimal dosage and timing for these therapies, especially in cats.
It sounds like there's still a lot we don't know about how to best manage these cases.
There certainly is, and this case highlights the critical need for more research into effective treatment options for bromethalin poisoning.
Now let's delve into one of the most perplexing aspects of this case, the delayed herniation. Why did this cat die so suddenly despite showing initial improvement?
That's a great question. It's possible that even though the cat seemed to be recovering, the damage to the brain continued to progress at a microscopic level. The initial treatment might have masked the underlying severity of the injury, leading to a false sense of security.
It was like a silent storm brewing within the brain.
Exactly. And then something triggered a sudden increase in intracranial pressure.
Right.
Perhaps a minor head movement or even stress leading to the fatal herniation.
Wow.
We also can't rule out the possibility of re-exposure to bromethalin. Perhaps the cat somehow got into more rodenticide at home.
It's a chilling thought.
It highlights the importance of educating owners about the risks of rodenticide poisoning and the need for careful storage and disposal of these products.
Absolutely. Prevention is always the best medicine.
I couldn't agree more.
Now, this case also raises questions about the potential role of MRI in diagnosing and monitoring bromethalin toxicity.
Yeah.
What are your thoughts on that?
MRI can be incredibly valuable in these cases.
Okay.
It allows us to visualize the brain and spinal cord, looking for signs of edema, inflammation, and other abnormalities.
Right.
And studies have shown that MRI findings can correlate with necropsy, results in bromethalin-poisoned animals.
So in this case, an MRI might have revealed the extent of the brain damage, even if the cat was clinically improving.
It's certainly possible an MRI could have provided more information to guide treatment decisions and potentially alerted the veterinarians to the risk of delayed complications.
It underscores the importance of considering advanced imaging in cases of suspected bromethalin poisoning, especially when neurological signs are severe or progressive.
I completely agree. Early and accurate diagnosis is crucial for maximizing the chances of a positive outcome.
Now let's shift gears and tackle one of the most perplexing aspects of this case, the delayed herniation.
Okay.
Why did this cat die so suddenly despite showing initial improvement?
That's a great question, and it really gets to the heart of the challenges we face with bromethalin poisoning.
So even though the cat seemed to be recovering on the outside, something sinister was happening inside his brain.
Exactly, and that something was likely a combination of factors. First, even though the cat was showing clinical improvement, the damage to the brain might have been continuing at a microscopic level.
Okay.
Think of it like a house that looks fine from the outside, but has a crumbling foundation.
So the initial treatment might have been addressing the most obvious symptoms, but it couldn't stop the underlying damage from progressing.
That's a good way to think about it. And then something might have triggered a sudden increase in intracranial pressure, pushing the already damaged brain past its breaking point.
What kind of trigger are we talking about?
It could have been something as simple as a minor head movement or even a stressful event, or it's possible that there was some level of re-exposure to bromethalin.
Right.
Maybe the cat got into more rodenticide at home, even though the owners thought they had removed it all.
That's a scary thought for any pet owner who's dealt with rodenticide poisoning.
It really is, and it highlights the importance of not only treating the poisoning, but also educating owners about the risks and emphasizing the need for ongoing vigilance and careful monitoring.
So what does all this mean for the future of bromethalin poisoning treatment? What are the key takeaways from this case?
This case serves as a stark reminder of the seriousness of bromethalin poisoning and the challenges we face in managing these cases.
Yeah.
We need more research to develop effective treatments and to better understand the long-term risks, even after initial recovery.
And it underscores the importance of prom decontamination efforts.
Absolutely. Time is of the essence with bromethalin poisoning.
Right.
The sooner we can remove the toxin from the body, the better the chances of preventing irreversible damage.
And finally, it highlights the critical role of owner education in preventing these tragedies.
Couldn't agree more. We need to raise awareness about the dangers of rodenticides and encourage the use of safer alternative pest control methods.
Now, Figure 1 from the case report really brings all of this to life. Can you walk us through what we're seeing here?
Of course. Panel A shows us a view of the cat's brain from above while it's still in the skull.
Okay.
You can see that the cerebellum, which sits at the back of the brain, is compressed and deformed.
Right.
This is because it's being forced downward through the foramen magnum, which is the opening at the base of the skull where the spinal cord connects to the brain.
Okay.
This is the transforaminal herniation we talked about earlier.
It's like the brain is being squeezed through a too small opening.
Exactly. Now, panel B shows a cross-section of the brain after it's been removed from the skull.
Okay.
What's striking here is how expanded and pale the white matter structures are. The corpus callosum, which connects the two hemispheres of the brain, is marked with an asterisk, and you can see how enlarged it is.
Right.
Similarly, the hippocampal fornix, pointed out by an arrowhead, is also noticeably expanded.
So this shows that the damage isn't limited to just one area of the brain, but is widespread, impacting the white matter, which is responsible for communication between different brain regions.
That's a great observation.
Thanks.
Panel C zooms in on the fixed brain, giving us a closer look at the area where the herniation occurred.
Okay.
It really emphasizes the severity of the pressure that led to the herniation.
And the last two panels, D and E, provide a comparison, right?
Yes, these images allow us to compare the brain of an age-matched control cat, panel D, with the brain of our patient, panel E. The differences are pretty dramatic.
It's almost like looking at two entirely different brains.
Corpus callosum, hippocampal fornix, corona radiata, and centrum semiovale, all white matter structures are significantly expanded in the patient's brain.
Yeah.
It's a visual testament to the devastating effects of bromethalin, and panels F and G show the same comparison but under a microscope.
Okay.
You can see widespread vacuolation or spongiosis in the patient's brain, which is basically the formation of fluid-filled spaces within the white matter.
So this figure really drives home the point that bromethalin causes significant and lasting damage to the brain, even if a cat initially shows signs of recovery.
It's a sobering reminder of the seriousness of bromethalin poisoning and the importance of prompt and aggressive treatment, but it also underscores the fact that there's still much we don't know about this toxin and how to best manage its effects.
This has been an incredibly insightful look into the complexities of bromethalin poisoning. But before we wrap up part one, I'd like to get your take on one more aspect of this case.
Sure.
The cat had a history of mild paraparesis, secondary to a suspected intervertebral disc herniation.
Okay.
Do you think that pre-existing condition played a role in its susceptibility to bromethalin or the severity of its neurological decline?
That's a really interesting question, and it raises a point that's often overlooked when discussing toxicology. Individual animals can vary widely in their susceptibility to toxins based on factors like genetics, age, underlying health conditions, and even nutritional status.
So it's not always a simple matter of like, dose makes the poison.
Exactly. It's likely that this cat's previous spinal cord injury made it more vulnerable to the neurological effects of bromethalin. The nervous system was already compromised, so it might have been less able to withstand the additional insult of the toxin.
That's a sobering thought for owners of pets with any sort of neurological history.
Yeah.
It seems like these animals might be at even greater risk from bromethalin poisoning.
It's certainly something to keep in mind, and it underscores the importance of taking a detailed history and considering all potential risk factors when assessing and treating these cases.
I think that's a great place to pause for now.
Yeah.
Join us for part 2 of this deep dive, where we'll delve deeper into the pathophysiology of bromethalin poisoning, explore some of the research into potential new treatments, and discuss what this case means for the future of rodenticide use.
I'm looking forward to it. Welcome back to our deep dive into this fascinating and tragic case of bromethalin poisoning in a cat.
You know, in part 1, we talked a lot about the treatments used in this case.
Yeah.
But it feels like we only scratched the surface of how bromethalin actually wreaks havoc on the cellular level.
You're right. The mechanisms of bromethalin toxicity are pretty complex, but I think it's worth unpacking them a bit so we can understand the full extent of the damage this toxin causes.
Okay, let's do it. Take us back to Biochemistry 101. Where does bromethalin start its path of destruction?
Well, like we touched on earlier, bromethalin's primary target is the mitochondria, the tiny powerhouses inside our cells responsible for producing energy.
Right, the ones we learned about in high school biology.
Mm-hmm.
They're like the batteries that keep everything running.
Exactly. And bromethalin essentially sabotages those batteries, disrupting a crucial process called oxidative phosphorylation.
Okay, now we're getting into the technical stuff.
Yeah.
Can you explain oxidative phosphorylation in a way that even I can understand?
So think of it like a complex assembly line inside the mitochondria. Electrons are passed along, and this movement creates a sort of energy gradient that's used to produce ATP,
Okay.
the main energy currency of cells.
Right.
It's how our cells convert the food we eat into usable energy.
So it's like a finely tuned machine, with each step carefully orchestrated to generate energy for the cell.
Exactly. And bromethalin throws a wrench right into the gears of that machine, disrupting the energy gradient and preventing the production of ATP. And without ATP,
Yeah.
cells can't perform their vital functions.
So the cells are essentially starved of energy, even if there's plenty of fuel available.
Precisely. And this energy depletion has a domino effect throughout the body, but the nervous system is particularly vulnerable.
The report specifically mentioned the paralysis of sodium-potassium ATPase pumps.
Yes.
What are those and why are they important?
Those pumps are like little gatekeepers on the cell membrane.
Oh.
They use ATP to move sodium ions out of the cell and potassium ions in, and this constant shuffling of ions is crucial for maintaining the electrical balance that allows nerve cells to communicate and muscles to contract.
So when bromethalin disrupts ATP production, Those pumps can't do their job, and the whole system goes haywire.
Exactly. When those pumps are paralyzed, sodium builds up inside the cells.
Right.
And water follows the sodium, leading to cellular swelling or edema. And as we discussed earlier, this edema is especially prominent in the brain and spinal cord, which are highly sensitive to changes in fluid balance.
And that swelling puts pressure on the delicate brain tissue, leading to the neurological symptoms we see in bromethalin poisoning, like weakness, incoordination, seizures, and ultimately even death.
It's a vicious cycle. The more swelling there is, the more pressure on the brain, and the worse the neurological signs become.
It's like a balloon expanding inside a closed box.
That's
Eventually
it.
something's got to give.
And that giving is often in the form of herniation,
Right.
where the brain tissue gets pushed through an opening in the skull, as we saw in this case. It's a tragic outcome, but it underscores the importance of understanding how this toxin works so we can develop more effective treatments.
Now, besides the edema, the report also mentioned that bromethalin causes damage to the myelin sheath.
Yes.
Can you remind us what myelin is and why that damage is significant?
Myelin is the fatty insulation that surrounds nerve fibers. Think of it like the rubber coating on electrical wires. It helps nerve impulses travel quickly and efficiently.
So when the myelin is damaged, the signal gets disrupted.
Exactly. The report described widespread vacuolation or spongiosis in the white matter of the cat's brain. This spongy appearance is due to fluid accumulating within the myelin sheath, causing it to swell and break down. And this disruption of the myelin further impairs nerve impulse transmission, contributing to the neurological dysfunction.
So bromethalin attacks the nervous system on multiple fronts, causing both edema and myelin damage.
Yes, and it doesn't stop there. Bromethalin also triggers something called lipid peroxidation.
Okay, now you're really testing my memory of high school biology.
Sorry, that's...
What is lipid peroxidation and why should we care?
Lipids are fats, and they're essential components of cell membranes.
Okay.
Lipid peroxidation is a type of oxidative damage that affects those lipids, causing them to break down. It's like rust forming on a metal surface.
Oh, yeah.
This damage disrupts the integrity of cell membranes, making them leaky and dysfunctional, and can eventually lead to cell death.
So it's yet another way bromethalin undermines the structural integrity of cells, particularly in the brain and nervous system.
Exactly. And the damage doesn't stop at individual cells. Lipid peroxidation can also disrupt the blood-brain barrier, which is a protective shield that prevents harmful substances from entering the brain.
So not only is bromethalin directly damaging brain cells, but it's also making it easier for other toxins and harmful substances to get in and wreak havoc.
That's a good way to put it. Bromethalin is truly a multifaceted attacker, and its effects are far-reaching.
This case really highlights the complexity of bromethalin poisoning and the challenges we face in managing this deadly toxin. It's not just about treating the symptoms, but about understanding the underlying cellular mechanisms so we can develop more targeted and effective therapies.
I completely agree. And while the current treatment options for bromethalin poisoning are largely supportive and focused on decontamination, there's a lot of ongoing research looking for ways to directly counteract the toxin's effects.
That's encouraging. Are there any particularly promising avenues of research you can tell us about?
There are a few areas that are generating a lot of excitement. One area is focused on developing drugs that can prevent bromethalin from disrupting mitochondrial function. If we can stop the toxin from shutting down those cellular powerhouses, we might be able to prevent the cascade of damage that follows.
That makes sense, like cutting off the problem at the source.
Exactly. And another area of research is focused on identifying specific antioxidants that might be more effective than ginkgo biloba or thiamine in protecting cells from oxidative damage.
Okay.
There's a whole world of natural and synthetic antioxidants out there, and researchers are trying to find the ones that can best counteract the specific type of oxidative stress caused by bromethalin.
So it's like finding the right key to unlock the body's defenses against this toxin.
That's a good analogy, and there's also a lot of interest in using nanotechnology to deliver drugs directly to the brain.
Wow.
This approach could allow us to bypass the blood-brain barrier and deliver high concentrations of medication precisely where it's needed.
It sounds like science fiction coming to life.
It really does. It's an exciting time to be in the field of veterinary toxicology. While cases like the one we're discussing today are heartbreaking, they also fuel our determination to find better ways to protect our animal companions from these dangerous toxins.
That brings us to another important point that was highlighted in the report. Bromethalin is becoming increasingly popular as a rodenticide.
That's right, and it's a trend that has a lot of veterinary professionals concerned.
Why is bromethalin use on the rise?
Well, it's partly due to recent restrictions on the use of anticoagulant rodenticides, which were once the most common type.
Okay.
These restrictions were put in place due to concerns about secondary poisoning of wildlife, especially birds of prey that feed on rodents that have ingested anticoagulants.
So in an effort to protect wildlife, we've inadvertently increased the risk to pets.
That's the unfortunate reality, and because bromethalin is so potent, even small amounts can be lethal, making it a particularly dangerous threat to curious cats and dogs.
So what can we do to address this growing problem?
I think it requires a multi-pronged approach, first and foremost. We need to raise awareness among pet owners about the dangers of bromethalin-based rodenticides.
Right.
Education is key. Owners need to understand the risks, know how to identify bromethalin products, and take steps to prevent their pets from accessing them.
That means being incredibly careful about storage and disposal of these products.
Absolutely. And it also means considering alternative methods of pest control, such as traps, bait stations that are inaccessible to pets, or even professional pest control services.
And what about from a regulatory standpoint? Are there any efforts to restrict the use of bromethalin or to require more prominent warning labels on these products?
There are ongoing discussions about the need for stricter regulations, but it's a complex issue with many stakeholders. Some argue that bromethalin is a valuable tool for pest control, especially in areas where rodents pose a significant threat to public health.
I can see how it's a balancing act, weighing the benefits of effective pest control against the risks to pets and wildlife.
Exactly. And ultimately, finding the right balance will require collaboration between scientists, regulators, pest control professionals, and the public.
This case really underscores the interconnectedness of animal health, human health, and the environment.
I couldn't agree more. Our choices about pest control have ripple effects that extend far beyond our immediate surroundings.
Now, before we move on to the next section, I want to touch on one more detail from the report that I found particularly striking.
Okay.
The authors mentioned that unlike dogs, cats typically manifest the paralytic or depressive form of bromethalin poisoning regardless of the dose consumed.
That's an important distinction in dogs. The clinical signs of bromethalin poisoning can vary depending on the dose. At lower doses, dogs may exhibit hyperexcitability tremors and seizures, but at higher doses, the signs shift towards paralysis and depression, similar to what we typically see in cats.
So it's like there's a spectrum of toxicity, and cats tend to fall on the more severe end of that spectrum, regardless of how much they ingest.
That's a good way to think about it, and it emphasizes the need to be especially vigilant when it comes to bromethalin exposure in cats. Even a small amount can have devastating consequences.
I think that's a good place to transition to the final part of our deep dive. Join us as we explore the implications of this case for the future of veterinary medicine and consider what steps we can take to protect our pets from the dangers of bromethalin and other rodenticides.
I'm looking forward to wrapping up this discussion with you.
Welcome back to the final part of our deep dive into this, thought-provoking case of delayed brain herniation in a cat following bromethalin intoxication.
Yeah, it's been a fascinating discussion so far.
It really has. We've explored the intricacies of bromethalin toxicity, delved into the potential benefits and limitations of current treatment options, and grappled with the ethical considerations of rodenticide use.
But as we wrap up, I'd like to kind of shift our focus to the future.
Okay.
Based on the insights gleaned from this case and the ongoing research you mentioned earlier.
Yeah.
What are your hopes for the future of bromethalin poisoning treatment?
I think my greatest hope is that we can move beyond supportive care and develop more targeted therapies that can directly counteract the toxin's effects. The research into mitochondrial protectants and potent antioxidants is incredibly promising. If we can find ways to prevent or reverse the cellular damage caused by bromethalin, we could dramatically improve outcomes for these patients.
Yeah, it's exciting to imagine a future where we're not just mitigating the damage, but actually preventing it from happening in the first place.
Exactly. And I'm also hopeful that advances in nanotechnology will allow us to deliver medications directly to the brain.
Right. Bypassing the blood-brain barrier and achieving higher concentrations of therapeutic agents precisely where they're needed. This could be a game changer for treating a wide range of neurological conditions, including bromethalin poisoning.
Yeah, it sounds like the future of veterinary neurology is filled with possibilities.
It certainly is. And in the meantime, I think it's essential to focus on what we can do right now to improve outcomes for these patients.
Right.
That means emphasizing early and aggressive decontamination, providing meticulous supportive care, and perhaps most importantly, educating pet owners about the risks of bromethalin and the importance of prevention.
Yeah, this case really highlighted the need for clear communication between veterinarians and pet owners, not just about the initial treatment plan,
Right.
but also about the potential for long-term complications and the importance of ongoing monitoring.
I couldn't agree more. We need to empower pet owners with the knowledge and resources they need to make informed decisions about pest control. And to recognize the early signs of bromethalin poisoning, every minute counts when it comes to treating this toxin. So prompt veterinary attention is crucial.
Absolutely. As we conclude this deep dive,
Yeah.
I think it's worth revisiting the broader implications of this case for rodenticide use.
Okay.
This cat's tragic death raises some tough questions about the balance between effective pest control and the safety of our pets and wildlife.
You're right, bromethalin is a highly effective rodenticide, but its toxicity is undeniable. We need to carefully consider the risks and benefits of its use.
Right.
And we need to continue exploring safer and more sustainable alternatives.
Do you think there's a future where we can eliminate the need for rodenticides altogether?
That's a great question. It's certainly a goal worth striving for, but achieving it will require a fundamental shift in our approach to pest control. Moving away from reactive measures and embracing more proactive and integrated strategies, that means focusing on habitat modification, exclusion, sanitation,
Right.
and other methods that make our environments less hospitable to rodents in the first place.
It sounds like a holistic approach, addressing the root causes of rodent infestations rather than just trying to eliminate the rodents themselves.
Exactly. And it's an approach that will require collaboration between scientists, policymakers, pest control professionals, and the public. We all have a role to play in creating a world where we can coexist with wildlife without resorting to harmful chemicals.
This case has really been a journey, hasn't it? From the microscopic level of cellular damage to the macroscopic level of ecological impact, it's given us a lot to think about.
It certainly has. And while the outcome for this particular cat was tragic, I hope that by sharing this case and discussing its implications, we can raise awareness, spark conversations, and ultimately contribute to a safer and healthier future for all animals.
Well said. I want to thank you for joining me on this deep dive. It's been a truly enlightening conversation.
The pleasure was all mine.
And to all our listeners out there from Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.